Hello, everybody, and welcome to episode 57 of the Pet Behavior Chat. So today's episode is going to be kind of a bit of a follow-on from episode 55, where I spoke all about Canine Cognitive Dysfunction Syndrome. And today I really want to focus on the kitty cats because we do also see cognitive decline in our feline patients. It's probably even less diagnosed, I would say, than in our canine patients. But I think it's really important to consider that, that's something that we need to look out for as well in our feline patients. I think also because our feline patients tend to be a little bit more independent, it might be easier to miss some of the signs. And there are some sort of subtle differences, and I'll definitely go through those today because we've got a slightly different clinical scale that we use in cats compared to dogs. But on the whole, the brain processes, the brain aging that occurs in cats is very similar to the pattern of that in dogs. So if you want to listen back to episode 55, where I kind of chat through all of that in dogs, that will probably give you a really good foundation, but I will touch on everything again in this episode. Okay, so let's get started as always with some definitions. And I think it's always really kind of interesting to me to see the different sort of descriptions of what a senior cat actually is, or the different, depending on the literature that you read, different places will cite different ages or different life stages as being senior. So the AAFP Senior Care Guidelines basically states that any cat over the age of 10 years is regarded as senior. We also have a kind of a subdivision, which is geriatric or super senior, which are cats over 15 years of age. So, that's kind of getting into the more extreme sort of ends, I guess, of senior health. And then what about the prevalence? So how many cats do we actually see that have cognitive dysfunction at certain ages? And again, there are different studies that come out with slightly different numbers. I like the one by Danielle Gunmore and Gary Landsberg, which basically states that cats between 11 and 14 years of age, 28% of those cats, so 28% of cats between 11 and 14 show signs of cognitive decline. And then 50% of cats over the age of 15. So that's that kind of super senior that we mentioned earlier. That's half of our cats over the age of 15 show signs of cognitive dysfunction. And if we actually think about how old cats can get, we see many cats that are over the age of 15. Many. I mean, I know a lot of patients that are in their late teens, maybe even their early 20s. And so if we think half of that population could be suffering with cognitive dysfunction, cognitive decline, then again, that's probably a huge patient base that we're leaving undiagnosed with some of these challenges. And there's actually a lot more that we can be doing in practice as well as in sort of private behavior practice, but even in general practice, there's a lot more that we can do to support these senior pets and their families. And, sort of create that awareness around senior pets and the special needs that they may have. So, yeah, I always am quite astounded by those numbers, quite how high they are, and really, how much of that pet population we're likely missing or underdiagnosing. Okay, so that's a little bit kind of the prevalence, the definition of what is a senior cat, how often does it occur, or how prevalent is it in the population? And I'd like to focus next on what are the signs, what are the behaviors that we might see with senior pets, and especially those that are suffering from cognitive dysfunction. And you'll have heard me speak about in episode 55, in the canine episode, of this DISHAA acronym that we use in dogs. And in cats, we have something similar. However, it's called VISHDAAL. So it's a slight abbreviation of DISHAA, because in cats, we do see some additional signs, I guess, that seem to be more prevalent in cats, certainly. And that is kind of portrayed in this VISHDAAL acronym. So I'm just going to chat through VISHDAAL. So the V in VISHDAAL is the one thing that is probably quite different in cats, and that's vocalization. And I'm sure many of you that are either cat parents or that are practitioners working in practice will have heard, this sort of excessive vocalization or extreme vocalization, especially in older cats. So that's one of the signs that we definitely see. So if we all of a sudden have an increase in vocalization, a change in vocalization, in particular nighttime vocalization, it seems is quite prevalent, then that's definitely a sign that we might be or that we should be looking out for further indications of cognitive dysfunction. So that's the V. The second letter in VISHDAAL is the I, which is interactions. So that's quite similar to DISHAA, the I in dogs. So that could be either increased or decreased interactions, both with human caregivers as well as with other pets in the home. In cats, that includes the emergence of perhaps aggressive behaviors as well. So that could be intercat aggression, new sort of signs of intercat aggression, or maybe even aggressive behaviors towards people. Now, we will talk about differential diagnoses in a second, and the fact that it's really important that we rule out other physical medical disease. And of course, when we think about aggression, pain is always a big one to think about there. But that's the I in VISHDAAL. The third letter is the S. So that's our sleep-wake cycle, again, very similar to dogs. And again, that's changes in patterns of a sleep-wake cycle. So we know that cats do a lot of sleeping anyway. So cats usually sleep for around 14 to 16 hours per day. But it could be, again, that we have increased nighttime waking. Perhaps we've got nighttime restlessness. The cats don't sleep through the night so much anymore. We could have increased sleep throughout the day, perhaps less activity, less interaction, and more sleep throughout the day. So just anything that is different from their previous sort of pattern of sleep-wake cycle. The H in VISHDAAL is house soiling. So again, similar to dogs. And in cats, this would be if cats are mainly indoor, or spend a lot of their time indoors. This could be urinating or defecating outside of the litter box, and that can be quite a recent or a new change. And again, sometimes that's to do with actually how the litter tray is. And again, we're thinking back to other physical medical diseases here. So if we're thinking about pain and osteoarthritic pain, maybe the litter boxes are uncomfortable to get into, and that's a reason that the cats are choosing to eliminate outside of the litter box. But if we're thinking truly about cognitive dysfunction, it could be a loss of learning or a loss of memory of where the litter boxes actually are in the home. It could also be that the litter boxes are difficult to get to. Maybe they have to go, down into the cellar or upstairs onto the first floor, or they're in places where the cats need to make an effort to get to. And again, that could be due to physical, medical, or it could be due to a loss in memory around where those litter boxes are. I'll talk a little bit more about sort of other physical diseases, because we do need to think about other things also when we're thinking about house soiling in an older patient. We'll do that in a second, but things like metabolic diseases, kidney failure, hypothyroidism, diabetes, all of those kinds of things are things that we need to think about as well. Okay, so that was the H in VISHDAAL. So now we come to the D, which is the first letter in the dogs, in the DISHAA, and that is disorientation. So that could be spatial or temporal disorientation. So that could be cats getting stuck in corners, or oftentimes behind doors is quite common. It could also be them standing in one spot, staring at one spot for a long period of time. So that's that temporal disorientation, that they just kind of lose track of time, and they're sort of standing in one area for a long period of time and not sort of moving away from that. So that disorientation piece is another important one. I think we probably see that more in dogs than in cats, but I would say that that's definitely something to keep an eye out for in cats as well. Then we come to the two A's in VISHDAAL. So we've got DAAL at the end. The first A is activity levels. So again, reduction in play, perhaps reduction in general activity. If cats were previously quite keen to maybe go outside and spend a lot of time outside, maybe hunting or doing normal cat stuff, and they're now spending more time indoors, that could mean a change in activity. Again, a decrease in play, and we'll talk a little bit more about that in a second. So again, any changes in activity levels. So that's the first A in the VISHDAAL. The second A would be anxiety. So any increase in anxiety, fearful behaviors, anxiety around new situations, perhaps anxiety around other pets in the home, anxiety around changes in routine, where that might have been something that they were previously more able to cope with. They're perhaps now less able to cope with changes in routine or changes in, let's say, for example, owners going away for the weekend or things like that. They get quite anxious and worried about those things. So just a general increase in anxiety levels. And then finally is the L, which again goes back to that learning and memory. So we know in cognitive decline, learning and memory are things that are affected. So it could be a loss of learning. So things that a cat perhaps had previously learned very well. So I go back to sort of the litter box example there, or even little tricks or things like that, or knowing where certain food places or resting places are, things like that. So a loss of learning and perhaps a loss of memory, which can be quite subtle, I think, to pick up. But I think in particular cat owners that know their cats very, very well, they'll be able to pick up on those more subtle things. So that's a little bit our sort of clinical diagnostic tool. Now, we've got some really lovely DISHAA for dogs, DISHAA questionnaires that we can ask owners to fill in. In fact, with all of my senior dogs, any dog over 8, I ask clients to do a DISHAA questionnaire every 6 months just to see if we have changes there, if we have trends, if we have, obvious deterioration. Actually, just yesterday, I saw a doggy who I hadn't seen for 16 months, a senior dog, and their DISHAA score had gone from 1, which is almost nothing, to 13 in the space of 16 months. And that was a bit of a sign for us that we hadn't done that often enough. So you can get quite significant deterioration in those latter years of life, and that can happen quite quickly. So my recommendation would be to do a DISHAA questionnaire for dogs every 6 months. And for cats, we don't have an official sort of questionnaire that's been made by anybody, but we can absolutely use our own VISHDAAL questionnaire and just question clients on that every 6 months, or get them to sort of fill in a kind of a homemade VISHDAAL questionnaire for us every 6 months. And I think that's a really good way of tracking what's going on, and also being a bit of an opener into the conversation about quality of life, welfare, and then being able to make changes around the home, or start considering treatments for cognitive dysfunction, which I'll talk about in a second. Okay, so before we go on to that, I just want to state the importance of being very, very comprehensive in our differential diagnoses. So cognitive dysfunction syndrome is a neurodegenerative disease. There is no cure for it. It's quite difficult to completely stop the progress of it, but what we can do is try and slow things down. So in that sense as well, it's a diagnosis of exclusion. There are no definitive diagnostic markers that will definitively give us that diagnosis of cognitive dysfunction or not. We can use our clinical tools like the questionnaires, but then we have to rule out all other medical diseases in order to leave us with a confident diagnosis of cognitive dysfunction. And in older pets, especially in older cats, there are so many. And I'll just touch on some of the sort of main ones. One of the most common being osteoarthritis and associated chronic pain with that. And some of the signs that we spoke about in our VISHDAAL acronym can absolutely be related to pain. So we've already said things like house soiling, reduced activity, reduced play, all those things can absolutely also be secondary to pain. So we have to make sure that we are addressing that very, very well to make sure that we're not overlooking pain, chronic pain, acute on chronic pain, all those things. And then, as all of us vets know, cats can show a multitude of different other clinical diseases that can cause different signs as they age. So I'm thinking in particular about systemic, metabolic, and endocrine diseases, so and organopathies. So we're talking about renal failure, liver failure, we're talking about diabetes, we're talking about potentially Cushing's disease. Hyperthyroidism is very common in cats. Hypertension, which can either be primary or secondary, so that's increased blood pressure, very common in cats. can be secondary to other diseases, or can be primary. So we always want to be checking blood pressure. In my experience, especially in those nighttime vocalization cats, we always want to be looking for hypothyroidism and hypertension in cats. And then sensory decline, so vision and hearing, but also perhaps undiagnosed infectious diseases such as FIV, FELV, and then all of the sort of neurological diseases that we can think about, including things like brain tumors, and then also urinary tract disease as well, especially if we're thinking back to litter box. So to be honest with you, kind of the entire cat we need to consider as potential differential diagnoses. And it's possible that we might find more than one thing. It's absolutely possible to concurrently have cognitive decline and something else going on, but we then need to kind of discern to what degree the one or the other is having an impact and influencing signs, behaviors, quality of life, and then that also needs to be reflected in our treatment plan. So really, really important that we look at all of those things. Okay, let's move on to, and I touched a little bit on this in the canine episode, but let's move on to what actually happens in the brain as the brain ages. So what are these sort of degenerative processes? What actually happens? And there are a number of different things, and I'm just going to quickly go through them one by one, but it gives us a bit of an overview of the complexity and there are quite a lot of things that are going on or that could potentially be going on in the brain. And it gives us a bit of an insight into, why some of these changes can lead to these clinical signs. So the first thing would be brain atrophy and neuronal loss. So we actually get a decrease in brain matter and a decrease in neurons, and we get an increase in ventricular size. So we'll have actually less brain matter, and that can sometimes be quite extreme. If you actually look at some of the MRI images of aging patients, whether they're dogs or cats, you can really see that sort of loss of brain mass quite significantly from a younger animal to an older animal. The second thing are vascular changes. So we can get changes in the microcirculation of the brain. You can get microclots, we can get little infarcts, and sometimes we can also get compromised blood flow to the brain, and that can lead to hypoxia, so reduced oxygen delivery to the brain. And that can also often be secondary to other diseases. So we spoke a little bit about hypertension and kidney disease or hypothyroidism. So all of those things can actually also affect the cardiovascular system, and that in turn might decrease circulation and oxygen delivery to the brain. So quite a complex sort of process there, but we also always need to be thinking about circulation to the brain. The third thing we want to think about are neurotransmitter systems. And here we've got two neurotransmitters in particular that we want to be thinking about. One of them is the cholinergic system. So we're thinking about the neurotransmitter acetylcholine. And we get a loss of cholinergic neurons with brain aging. And that can often lead to these deficits in memory and learning. And so it's really important that we avoid anticholinergic drugs. So some of our psychopharmaceuticals, for example, are anticholinergic, such as clomipramine, paroxetine, for example. So in an older patient, we always want to avoid anything that's going to reduce that cholinergic function even further. So that's the first neurotransmitter system. And the second system is our dopamine system. So we know that we get less dopamine production, or perhaps more dopamine breakdown. And so dopamine, number one, is very important in motor function. But again, dopamine is important for mood and for memory and for all of those. So motivation, learning, pleasure, all of those types of things. And if we get loss of dopamine in older age, that can sometimes lead to depression and to altered mood states, and also to decreased motor function and a number of those things. So dopamine is another really big one. And dopamine is definitely, well, both acetylcholine and dopamine are neurotransmitters that we think about when we think about treatment and what medications we might be able to use to actually help these patients. And then we've got a couple of very sort of specific changes in the aging brain. So we get what we call beta amyloid plaques. This is very, very similar to what also happens in the human aging brain. So oftentimes dogs and cats will be used as models for human dementia and Alzheimer's because they have quite similar pathology. So these beta amyloid plaques are quite important. They're a little bit different in the cat brain than in the dog brain. So we see more diffuse beta amyloid plaques in cats than with dogs. But yeah, definitely something that we can see in the aging brain. And then we also see tau pathology. So we see this hyperphosphorylated tau, which are potentially early stages of what we call neurofibrillary tangles. And again, things that we see in the aging brain that contribute to all the signs that we've been talking about. So quite a few things going on in the brain there, and things that also do give us a little bit of an insight into what we can perhaps use to support the brain as it's aging. So especially if we think about kind of the microcirculation, the decreased oxygen delivery, and those neurotransmitter systems. Okay, so let's move on to treatment. And I did go through this quite extensively for our canine patients, but I'm going to let you know what we have at our disposal for our feline patients. And treatment absolutely comprises medications, supplements, potentially diets, but there are other things that we need to consider for treatment as well, which is also behavior modification and also environmental management. So we're going to sort of talk about those three broad categories. Now, for dogs, we actually have a couple of diets that are very, very helpful for brain aging. We've got the Hills BD diet, and we also have the Purina Purina ProPlan Neurocare diet. We do not have those available for cats. And the active ingredient, or the main ingredient in the Neurocare diet, which is the medium chain triglycerides, is actually quite unpalatable for cats. So I think, there's still quite a lot of work being done on how to potentially increase palatability and how to potentially increase or get that into a feline diet. But I don't believe that is there yet. And the BD diet by Hills, which is the brain diet, is, to my knowledge, also only available for dogs. There are a few diets for cats. We've got the Hills Feline Mature Adult. So a lot of the mature diets will have some additives that are good for brain aging or good for brain function. The ProPlan has the 7+. So again, yet another mature diet. So they're a little bit more unspecific. They're more sort of general mature diets, but some of them do contain some positive supplements in there. And then we've got a couple of other diets that we can consider for older cats. We've got our Hills JD, which is our joint diet. So if we're thinking about aging cats in terms of their joint health, that's something that might be beneficial. And then we also have our Royal Canin Calm diet, which has alpha-casozepine and L-tryptophan, which might help for general sort of overall anxiety. So nothing specifically diet-wise for cognitive dysfunction, but it's always good to consider diets for a senior pet anyway. And, I think that's something that can be thought of regardless, of whether the cat is showing obvious signs of cognitive dysfunction, and especially if they are overall a little bit more anxious, or if we do have known arthritis or joint disease, some of those other diets might be quite helpful. So that's as far as diet goes. In terms of dietary supplements, I mentioned a few in the canine episode as well. And yes, we can use some of those supplements are also formulated for cats. So we have our Activate for cats, for example. We have our Senilife, which is also available for cats. And we can also use our Samilin, which is our SAMI. S-adenosyl methionine. Oh, I can never say that word. We can also use our SAMI supplements for cats. So we have absolutely got some supplements. And these supplements, as I mentioned in the canine episode, are primarily have antioxidative functions. Oftentimes there'll be vitamins and antioxidants, and they are also cell membrane stabilizers. So they basically help to mop up some of the free radicals that might be developing more prevalently in the aging brain. And they just help to generally maintain neuronal function and help those neuron membranes remain quite stable. So supplements, definitely. Obviously with cats, there's always that question about how easy is it to administer anything, whether it's a supplement or a medication. So we always need to weigh that up. How potentially stressful is it for an older patient to be administering a number of different supplements and or medications that they might need. And we might need to weigh up if these cats are on other medications, let's say pain medications for arthritis or anything else for any other disease. We might need to prioritize those medications over supplements for cognitive dysfunction. That's why the diets are or would be very helpful, because we're feeding our pets anyway, and it's just one less thing, I guess, to have to give. But certainly supplements can be very, very useful. In terms of medication, we have one psychopharmaceutical medication which is actually licensed for canine cognitive dysfunction, not for feline, which is selegiline, which is a monooxidase. Why do I always get this word wrong? Selegiline is a monoamine oxidase inhibitor. Thank you. Monoamine oxidase inhibitor. So it prevents the breakdown of monoamines, and dopamine is one of them. So it inhibits the breakdown of the monoamine neurotransmitters, dopamine being one of them. So it preserves more dopamine in the brain. So selegiline is definitely something that can be considered. I'd say it's more commonly used in Europe. You have to be quite careful because it's incompatible to use with a number of other medications. So you really need to know the medication quite well. And it does take a few weeks to take effect, but that's definitely an option if you have signs of cognitive dysfunction and you perhaps don't have maybe many other concomitant diseases that might require other medications. So selegiline is definitely something that can be considered. We have a medication called propentophyline, which increases the microcirculation of the brain. That's something I mentioned also for dogs, but can also be used for cats. And then obviously we have our other anxiolytics, so other SSRIs, potentially benzodiazepines or other anti-anxiety medications. But with those, we have to be extremely careful. They cannot be combined with selegiline, for example. So, and, we might choose another anti-anxiety medication over selegiline if we feel that we have an indication for that. One nice SSRI that we can consider is sertraline, because that actually has a slightly more dopaminergic effect than the other SSRIs. And I'll often use sertraline in my older patients, sometimes instead of selegiline, because I feel it perhaps is a little bit easier to use. So that's a good option, and sertraline can absolutely be used in cats. So yeah, we can absolutely consider medications to support these pets. And then we've got a couple of other sort of newer medications, which I'm not particularly familiar with using, but there's more and more sort of, I guess, in the literature about it. One of them actually targets the acetylcholine system, the cholinergic neurotransmitter system that I mentioned earlier. So we can consider choline esterase inhibitors such as donepezil, not tested in cats. So I'd be very, very cautious at this point in time using it in cats, but just to give you an idea of what's sort of upcoming and emerging. And then we can also think about dopamine transporter blockers such as modafinil, which is also something that has been talked about in dogs. Again, not widely used in cats. And I personally probably wouldn't be going there just yet until we have a little bit more experience with those medications. But it's to give you an idea of the progress that's being made in the field, and that we are thinking about using other medications that can help in the cases of cognitive dysfunction in dogs and in cats. So those would be your diets, your supplements, and your medications. Now, environmental management, I feel for cats is really, really important. So optimizing the environment so that cats can have easy access to favorite places, whether they're resting places or feeding stations, easy access to the outdoors if that's what they're used to. Just making life a little bit easier in general for them. I see a lot of older cats not being able to access places that they previously really loved, because it's just too difficult for them to get there. So that's probably my number one big tip in terms of sort of environmental modification and environmental management. And then obviously we always want to follow the 5 pillars of a healthy feline environment. And there's definitely a number of podcast episodes that speak particularly specifically about that, which I'll put in the show notes. And we always want to make sure that our 5 pillars are addressed. So that means hiding places, resources, human-cat interactions, play and predatory behavior, and respecting a cat's sense of smell. So all of those things, always, not just for senior cats, for any cat, are really, really important to consider. But particularly making those adjustments for our senior pussycats is really important. So that's the environmental management piece. And then the final piece, in terms of treatment, that I just want to touch on is behavior modification. And that goes a little bit back to our whole use it or lose it sort of principle. So even though our cats are older, we still want to engage them in play or in kind of cognitive tasks, maybe giving them food puzzle toys or hunting toys. Even if they only play for 10 or 20 seconds, that's already going to be something, and that's already going to be something that's enriching. As cats get older, their amount of play reduces naturally, but it's really important to still kind of stimulate them and to still engage them in some of those things. And it's really important for the human-animal bond as well. You'll know what your cat's favorite toy is, whether it's a wand toy or a crinkle toy or a little mouse or something, and just keep offering it, keep presenting it, and don't be discouraged if they don't immediately play or if they don't play on that day. But keeping them stimulated, keeping them active, keeping their kind of feline behaviors activated, I think is really, really important. And it actually does have brain benefits. So we know in the hippocampus, for example, all those kind of synapses that are strengthened through learning, they will become weaker if that learning isn't maintained. And it's, as I said, just like us, playing Sudoku puzzles or doing bridge. My mum plays a lot of bridge, and I know for a fact that has kept her mentally very, very engaged and very active. So the same we should absolutely do for our kitty cats as well. So just because they're getting older, please don't stop playing with them, and please don't stop engaging them in those types of activities. Okay, so my final piece before we wrap it up for today is how can we actually prevent brain aging, or how can we slow down, or how can we positively influence brain aging? And there are a few really interesting things actually that are factors that we know affect cognition, and some of them are relatively easy to already implement into the lives of your young cats, to hopefully prevent them from getting cognitive decline, or at least to slow things down and to make sure they stay as mentally healthy for as long as possible. Obviously, the first obvious biggest factor is age. So the older they get, the more prone they will be to getting cognitive dysfunction syndrome. So we really need to start thinking about these things at the age of maybe 6 already, 6, 7, 8. So those are the ages that we start to see that and start doing those VISHDAAL questionnaires from the age of 8, absolutely. Genetics, breed, those can all play important roles. Trauma, early life experiences, early learning, that can also affect brain health in general, and how well patients age. One really big thing is diet. So we know that a good quality diet from an early age can absolutely help prevent signs of cognitive dysfunction. So having your pet on a really good quality diet from a young age is really, really important. Sensory decline can affect brain health as well. So making sure that we do regular checkups, ocular checkups, ophthalmology checkups, oral checkups, making sure that we preserve their sensory function is really important. And then the other big things are pain and inflammation. So treating pain early, and inflammation is a really big one. And the reason I think about this in cats is that I think cats have so much undiagnosed and untreated dental disease and periodontal disease that having regular dental treatment from an early age can very likely influence brain health at a later age. And so we absolutely can do things preventatively to help, slow down or avoid some of those cognitive decline signs in older age. And then another one in cats that's a big one is feline infection, so the FIV virus. So I think, again, the feline immunodeficiency virus, FIV. So again, I think getting cats screened at an early age for all the viruses. So you want to be doing FIV, FELV, vaccines for FELV if they're available in your country, but FIV definitely also can affect brain health, brain aging, and potentially can lead to signs of cognitive dysfunction. But I thought those things are so interesting because we do have some influence on how well our pets age. I think, diet, regular dental checkups, making sure that their senses are functioning as well as possible, making sure that, they don't have infectious diseases, screening them for FIV, for FELV, ensuring their behavioral health over a lifetime, making sure they don't live with chronic stress. All those things are going to be really important when it comes to the prevention of feline cognitive dysfunction syndrome and to the healthy aging of our kitty cats. So that's a bit of a kind of a quick trek through feline cognitive aging and feline cognitive health. I hope that that's been useful. It's a topic that I absolutely love because I feel it's so important that we help our pets age well, and that we really make sure they stay comfortable and with good welfare and good quality of life in their later years of age, in their twilight years. So I hope this has been helpful for you. Please let me know if you have any questions, and have a listen to episode 55 if you're interested in the same topic in dogs. But yeah, this was the cat version of that. So I'm looking forward to seeing everybody next week for episode 58. And until then, I hope you have a great week. Bye for now.